welcome back to Rohrich Knows Podcast, helping you become a better you. I'm Rod Rohrich. I'm a plastic surgeon in Dallas, Texas, and I am thrilled to have Dr. Alexis Hazen with me today. She's a board-certified plastic surgeon in New York City. She's the host, one of the original hosts of Sirius Radio Plastic Surgery. It's an amazing network. I've been on several times with Alexis and some of her co-hosts. So welcome, Alexis. How are you?
I'm good. I'm really good. So happy to be here with you.
Great. So today, let's talk about non-invasives. Non-invasives are the hottest topic by far because everybody wants to look like they've had plastic surgery, but they don't want to do surgery, right? So that's why it's the hottest topic. That's why Botox and fillers have gone through the roof. And surgery has gone like this, and non-invasive have gone through the roof, and especially during COVID. So what is your favorite non-invasive technique that works, and tell us why?
I guess I have a couple things, but I love, everybody wants skin tightening, right? And everybody wants non-surgical skin tightening. And I think there are a couple of new techniques that have relatively low downtime that actually work. And one of them is radio frequency combined with microneedling. Right. And that is great all over the body. It's good on crepey skin. The downtime is really is really quick. Right. And the recovery is easy. CO2 laser, fractionated CO2 laser on the face is incredible for skin tightening, but there's a real downtime associated with that. And that's, I mean, we've been doing that forever, right? So it's not new, but the fractionated version gives you a little bit quicker recovery than the non-fractionated, which, most people don't do anymore. But I love those. I think it makes people happy. They get a real effect, and you can see results in one treatment. The manufacturers always recommend 3. There are a bunch of different brands. I think it probably doesn't matter which machine you use. I happen to have Morpheus 8, but I think they're all good.
Yeah, no, I agree.
So that's the thing I'm most excited about these days, because you get real results, and it's an in and out procedure. It's just in the office. They go home. They look pretty good the next day.
Yeah, and it's minimal discomfort. I mean, obviously you can numb them up, or you do give them some gas, laughing gas. But I like Morpheus 8. I think it works great, and it's obviously serial treatments. Obviously, the more you do, the better it is. And there's hardly any downtime. I agree. Lasers and peels, obviously a little more downtime, but the results are fantastic. And then just great skincare. I mean, I know you talk a lot about skincare. I mean,
and I think if you're going to do anything surgically, it makes no sense to do it unless you're going to take care of your skin. So, for anyone who gets a facelift or gets any kind of cosmetic surgery on the face, you got to start taking care of your skin with, basic stuff. I mean, Retin A, tretinoin for increasing the collagen, hyaluronic acid, avoiding the sun or sunscreen. And then there are little things you can do just throughout the year, like getting a peel every now and then, and using anything that is an antioxidant is very helpful for DNA repair on your skin. And that's what we're trying to do. We're trying to stop the clock or reverse the clock. So every day, our poor little DNA gets damaged, and anything you can do to reverse that, or at least halt it, is helpful. So that means things like antioxidants, anti-inflammatory, topicals are super useful on the skin.
Yep, no, I agree. Great skincare, avoiding the sun, obviously doing discrete amount of neuromodulators and fillers, don't overdo it. And then all the things to help with skin tightening. Those are great things. What about supplements? Do you take supplements?
So, it's interesting because there was a lot of kind of negative stuff about taking collagen supplements.
Oh, it works.
But now it's come out that it actually works. And there were a lot of people that sort of said, well, it makes sense that it works, so I'm going to take it. So yeah, I take collagen. I take anything that's like going to lubricate my joints, my skin, my hair. So all the omega-3 fatty acids. And then, I slather my body in hyaluronic acid.
Yeah. No, I agree. And, there's science behind collagen. There's even developing science about NAD.
Right. So I take NAD plus, which is basically, there's a theory about aging that it's all based on mitochondrial kind of damage, and that if you could stop that, halt that, you could actually slow down your aging. So NAD has some great promising results. It's a supplement. You take it once a day. So I've been taking that. I mean, it seems like no downside.
Right. No, I agree. And then vitamin C. Vitamin C is good, in 1 to 2 grams a day. These are all things that have good science. And I actually recently did a podcast on the things that have good science, and that includes, the antioxidants, vitamin C, NAD, and I think, these are the ones you take. And the one thing that has been an outlier that people used to say we should do it all the time is take a baby aspirin. And baby aspirin is something you probably shouldn't be taking now, even though the Harvard study for years said you should do it, especially in males. Now they've flipped and said you probably shouldn't because there's such an increased risk of bleeding, especially in people over 60, male and female. So
it's you stop doing it. Yeah, it's a very serious medication, and the risk of bleeding is real. I think one thing we're going to see on the frontier of skincare is prebiotics and postbiotics.
Yep.
And we know about probiotics for the gut, and we talk about the gut biome, but there's a skin biome which is very similar. So there's normal flora on your skin that is actually healthy. And so one of the things that we're really learning is that you don't want to strip your skin of everything, that's actually damaging to your skin. And so there's some balance between cleansing and actually keeping some of the good stuff on there. So prebiotics you're going to see more of this in skincare, and you're seeing it now in cleansers. And the idea is that what doesn't strip everything, it leaves some of the good stuff on there. So prebiotics are like gas for the skin, and postbiotics are similar to probiotics. Probiotics are living, and postbiotics are the non-living byproducts that are basically helpful for your immune system. And your skin is actually a huge part of your immune system. So I think that's going to be the next frontier in skincare.
Yep. No, I agree. Personalized skincare, using your own biome, your skin biome, your GI biome, which probably can unlock all these things that, can prevent bad problems and diseases. I mean, I agree.
Yeah.
And, there's a lot of science coming out from that. Great. So what are the 3 things that you can tell our viewer about just making and doing common sense thing without surgery that you can do now?
Yeah.
I know you mentioned obviously sunscreen and skincare is number 1, but
so, it's so basic that I don't even like to say it, but I'm going to say it because people don't do these things. So you have to get enough rest. And that doesn't mean that you need to sleep 8 hours a night or even, 7 hours. But you need to recharge, and you need to de-stress. And people who are stressed, it ages them. It ages every part of them. And, the best example that is tangible is, every single president, they go into the White House with dark hair and they come out with white hair, and the stress level literally changes your DNA. So that's one thing. You really got to do that. You have to do everything in moderation. So you were talking about neuromodulars and fillers. All those things are wonderful and they look fantastic until they don't.
Yeah.
And if you overdo it, it looks crazy.
Right.
And people, it's not only not anti-aging, but it just makes you look totally weird.
Exactly.
And then I think the other thing is it's great to be on the cutting edge of things and but but do your research. Make sure that you're going to a good place, that the facility is vetted,
Right.
and any treatment you get, don't get a Groupon and go because it's cheap. Like, go to somebody who's good, who's qualified, because all of these treatments can be treacherous.
Exactly.
And I've just been reading about fillers that have contaminants in them and the terrible problems that can happen with that. And so if you want to go to a facility and a person who is vetted and qualified. I think that's really the most important thing.
I agree. Just like in surgery, your best outcomes comes from highly experienced and qualified, plastic surgeons, and the same thing in injectors. You got to go to a place that actually has qualified and expertise in it. You can get cutting edge and bleeding edge, just don't go over the edge. That's the big thing, and I think a lot of times people go over the edge, and then guess what? We get to see them.
Yep.
Like I just got a call from a leading company where they injected a skincare product in the eyelid. Now, just crazy stuff. You can't make this up. So don't do crazy stuff. And I think, wise words from Dr. Hazen. Find somebody that's an expert in what they do. It doesn't take long to do it. You can find it, not only social media is a starting point, but, ask your friends, go do your research,
Yeah, absolutely.
And know before you go. So thank you so much, Dr. Hazen, for joining me today. Dr. Hazen,
You're welcome.
fantastic plastic surgeon in New York City, helping you become a better you. Give us your thoughts and comments, and until the next time, stay safe.